He went to the NICU. He was born at about 10 o'clock in the morning, and he had that whole day he hadn't fed, and he couldn't keep anything down. He was refluxing everything, and by about 11 o'clock that night, we consulted with a pediatrician, and after we took an X-ray of his abdomen, and at that point we figured, jointly made a decision and guided by the pediatrician, of course, that it was in the best interest of him to transfer him down to the NICU. He was there all total for about 8 days, and it was a roller coaster experience. It was from the beginning to the end, the physicians and the nurses were all in, and they made it clear that they were going to figure out what was going on.
Walker came to the NICU for a gastric conditions, where he had difficulties of feedings, and also he had episodes of vomiting in some kind of gastric obstructive process called gastric lactobacillus. That is a relatively rare condition. It's very important to understand that having your baby in an intensive care settings is very stressful. And the baby is not only our patient, but the whole family became our patient, because we have to integrate the family in the care of the baby and also release the stress that the family goes through these difficult moments.
Nobody expects to have their baby go to the NICU, and it's our third baby. So for me, I didn't even consider it. I didn't even think, I didn't think that was a possibility. So I do have to say I was very nervous and very anxious. It was hard. It was very hard for me to sit down. So vulnerable.
It was an absolute blessing that we were at Broward Health for this delivery, and level 3 NICU was steps away. Those physicians, those nurses, they made the entire experience that much better to go through. And I would highly suggest parents who are considering delivering a baby to consider doing it at Broward Health next to a level 3 NICU, so they have that access to those physicians, to that technology, to that medicine.